Hello everyone, my name's Natalie and I'm the Senior Macmillan Physiotherapist at Northampton General Hospital. In today's videos, I'm going to talk through 2 simple exercise programs that you can do during your hospital admission. Before we start, I'm just going to give a brief introduction into the benefits of exercise during your hospital stay and some safety considerations for before, during and after you start the exercises. So let's start by exploring why exercise is important. Whilst in hospital, it can be very hard to keep active. Not only is your daily routine disrupted, but you will most likely have increased levels of fatigue. This may mean you spend prolonged periods in bed or sitting in your bedside chair. This can lead to muscle wastage, reduced function and loss of independence. Spending long periods of time in bed can also increase your risk of chest infections, developing pressure sores and cause constipation. Engaging in even some exercise and regular movement during your hospital admission can help reduce your length of stay, prevent muscle wastage and will actually help reduce fatigue and improve your energy levels. Research has shown that there are benefits to being active at any stage of cancer, whether that be before treatment starts, during treatment, after treatment, and for individuals receiving best supportive care. Exercise can also help increase appetite and improve uptake of essential nutrients. So before we start, please just check the following. How are you feeling? Check with your therapist or nurse if you feel unwell, for example, dizzy or nauseous. Do you have any attachments that could get easily pulled or caught? For example, a catheter or any IV lines. Please again, just check with your nurse or therapist before starting if you need to be detached or if you're unsure if you need to wait and ask advice. Is your call bell nearby if you need assistance? And if you are due to receive a transfusion, do you know your latest blood results? This can help you understand your symptoms. For example, if you're anemic, you may get more fatigued. Again, just check with your nurse or therapist if you'd like to know these results. And have you had some pain relief if required? And finally, before you start, have you eaten? If you're not on a specific feeding regime, try and make sure you've had a meal or snack high in carbohydrates before exercising to help give you the energy to complete the exercises. This could be something like toast or, for example, a jacket potato. During the exercises, try and avoid using any weight or resistance if you have a low platelet count. Again, if you're unsure of your platelet count and you'd like to know, just speak to your nurse or your therapist before starting. Try and break down the exercises into manageable chunks. So in the recordings, the exercises are going to be shown as one circuit, but feel free to just do a couple of them or take breaks and pause the video as required. And stop if you feel dizzy or notice that any of the exercises cause your pain to get worse. And remember, keep hydrated, take sips of water throughout, and most importantly, remember to breathe. And then finally, once you've completed the exercises, take a note of how you feel. If you like, keep a note of how many repetitions you've managed so that you can track your progress, and speak to your therapist if any of the exercises feel too difficult or likewise too easy. Try and have a high protein snack or meal after you've completed it. For example, a protein sort of drink such as an Ensure or a 40-sip, or foods such as yogurts or eggs, as this is going to help with that muscle gain and the muscle recovery. So now we've covered the brief introduction, let's get started with the exercises. Okay, so we're going to get started with the chair exercises. So just make sure that you're in a comfortable position. Avoid sitting too close to the edge as there's a risk of slipping off, but also make sure that you're not slumped back as we want to be engaging your core muscles. So just shuffling forward slightly so your back is not leaning against the backrest. And we're going to start with our ankles and feet. So what we're going to do is we're going to tap the toes and then lift the heels. Okay, so it's a bit of a coordination movement as well here. So you're tapping the toes and lifting the heels. And what you want to try and do with this movement is really make sure that as you lift the heels, you're pushing the ground away. And as you tap the toes up, you're really lifting your toes up towards the sky. And we're aiming for about 5 to 10 repetitions of this. But as always, either increase the number or decrease as you feel able to. So nice and controlled movement, tapping the toes and lifting the heels. I'll just do a couple more of those just to demonstrate. Good. Okay. The next movement we're going to go on to is something called a knee extension. So we're going to do one leg at a time. And all you're going to do for this movement is you're going to straighten your leg out, pulling your toes up towards you, and then nice and controlled back down, and then switch into the opposite leg. So pulling those toes up towards you, knees should be straight, and then nice and controlled back down. With all of these movements we're going to do today, try and make sure you're going as slow as possible, as that's really going to put the muscle under more tension. So try and avoid kicking the legs out, nice and controlled, slow movement, keeping that chest up, as you may find you start to lean back. We want to keep those core muscles engaged. So I'm just going to do a few more on each side, pulling those toes up, nice and controlled back down. You can probably keep count better than I can. The next movement we're going to do is a seated march. So again, for this one, try and make sure keeping your chest nice and upright. You're going to be lifting your knee up towards the ceiling and then switch sides. Again, with this one, like I said, you might find that you start to tip back. If you need to, you can use your hands for support, or you can put your hands across your chest to make it more difficult. So lifting those legs up, clearing the feet off the floor. And again, looking about 5 to 10 repetitions on each side, if you're able to. Okay. And then the final exercise we're going to be doing for the lower limb is we're going to be bringing the feet nice and close together, and we're just going to be opening the knees apart, keeping the feet together and back in. So opening the knees apart, back together. Now, if that feels very easy, what you can do is get your band. So you can speak to your therapist if you haven't got one, wrapping it around your legs and making a nice grip, nice and tight at the side of one of your legs. And it gives just a little bit of resistance, but again, nice and slow movement as you're bringing your legs apart. Good, so I'll just do a few more of those. Again, trying to almost resist the band as it's bringing your legs back in together, as you'll feel it wants to pull your legs in. Good. Okay, so that's the lower limb exercises. Now we're going to move on to some for your upper body. Okay, so moving on to the upper limb, we're just going to start with some movements for the neck. So just nice and slow, just to warm up, we're going to take our right ear to our right shoulder, and then nice and slowly back to the middle, and then left ear, left shoulder, back to the middle. We're just going to do this a few times on each side. It's a really good movement, especially if you're spending a lot of time in the bed, just to warm up those neck muscles and keep your neck moving. Good. And then even just turning your head over your shoulder and then over the opposite shoulder. And again, just doing a few of these just to warm up. Good. And then just moving down to the shoulders. So just rolling the shoulders forwards. Again, making sure that you're not leaning back on the chair. You're nice and upright. Rolling them forwards and then rolling them backwards. Good. And then you're going to shrug the shoulders up towards the ears and then squeeze them back down. And again, just doing this 4 to 5 times. Again, for each movement, this is more a bit of a warm up, get that blood flowing, shrugging the shoulders up and down. Okay, the first movement that we're going to go on to is a bicep curl. So with this movement, you want your palm facing upwards, elbow should be glued into the side, and you're just going to bring your hand towards your shoulder and nice and controlled back down. Now, if you find that for some reason you've got a bit of restriction that you can't reach your shoulder, or you might have a cannula in, for example, just nice and slowly with the movement, just go as far as is comfortable. If you're finding that too easy, you could use, for example, a water bottle if you've got one for a bit of resistance, or again, you can use the band. And what you can do with the band is you can stand on it with your foot, taking a nice palm facing up grip and curling it up nice and controlled again. And again, you're looking for about 5 to 10 repetitions on each side. So just switching over the legs, remembering that palm facing up, elbow glued into the side. Good. Okay. The next movement we're going to be doing is just a forward press. So palms facing in towards each other. We're going to be pressing the arms forwards and then squeezing the shoulders back, almost like you're sticking your chest out, pushing the arms forwards, squeezing back. Again, if you'd like to make this a little bit more difficult and add a bit of resistance, you could either grab the pillow in front of you, I'll do this from the side just so you can see, and push the pillow forwards and back. Again, you could also hold 2 light weights or your water bottles and give a bit of resistance. Or you can also use the band. So with the band, holding one arm down to your side as you push forwards. And then you would switch arms and push forwards with the opposite. Okay, do a couple more on this arm. Okay, the final movement we're going to do for the upper body and to finish off the chair exercises is a shoulder press. So again, palms are going to be facing in towards each other and you're just going to be raising your arms upwards and then nice and slowly back down. Again, just going as far as is comfortable for your shoulder movement. And again, if you want to make it more difficult, bringing in that pillow again to do the overhead press, using those light weights if you've got them, or again, you could use the band. So band would be the same down by your side as you push upwards towards the sky. So just do a few on each side and then an opposite arm pushing upwards, and try if you can to keep your palm facing inwards as you push up and down. Perfect. So that's the lower body and upper body chair-based exercises. So take a note of how you're feeling afterwards. Hello everyone. So now we're going to go through a very simple bed-based exercise program that you can complete while you're in hospital. So the first movement we're going to go through is just to start with some ankle pumps. So the idea is you're going to be pulling your toes up towards you and then pushing them away. So pulling them up towards you and then pushing them away. So this is really good just to get blood flowing round to the lower limbs, especially if you're getting any fluid pooling around the ankles. So just really nice exercise to do throughout the day. And again, you can even do ankle circles, opposite direction. So this is just a really good one just for a bit of ankle mobility. As I said, get that blood pumping around, particularly if you've been laying down for a long time. The next movement we're going to go on to is something called the static quads. So the idea with this movement is that you're going to be squeezing your knee down into the bed whilst pulling the toe up towards you, holding for a count of 3, 2, 1, and then nice and slowly relaxing. Now this is quite a difficult movement to see, so what you want to be doing is putting your hand on top of your leg, and as you pull your toes towards you and squeeze the knee down, feel if you can feel that muscle tensing under your hand. So you should be able to relax, and then as you push your knee down into the bed and pull your toes up towards you, you should feel that muscle tensing underneath your fingers. Okay, and again we're going for about up to 5 repetitions if you're able to on each leg, holding for a count of 3 in that tensed position with the knee being squeezed down, and then relax. I'll just do a couple more on my right leg. And again, this is a movement that you can be doing throughout the day. And then relax. The next movement is almost a progression of this one, and it's called the straight leg raise. So you're going to be again pulling those toes up towards you, but you're going to be trying to lift the legs straight up off the bed, holding for a count of 3, 2, 1, and then nice and slowly back down. Now this is quite a difficult movement, so if you find that you're struggling to lift the leg off the bed, focus on that one of squeezing the knee down. But if you feel like the squeezing the knee down one is easy, have a go at this one. And like I said, try and avoid flinging the movement up quick. It should be nice and controlled, nice and slow. Again, aiming for about 5 to 10 repetitions on each leg, but increasing that or decreasing that as you feel able. So I'm going to do a few on this side. And you might feel that your leg starts to shake. That's just as the muscle begins to get tired. And then back down. And I'll just do one more on this side just to show. So again, nice and straight with that leg as you pull your toes up and lift the leg up towards you. And then back down. The next movement we're going to be doing is a knee bend. So again, in a nice comfortable position, you're going to be bringing the knee up towards the chest and then nice and controlled back down. Knee up towards the chest, nice and controlled back down. If you find that lifting the leg up off the bed and bringing it towards you is too difficult, what you can do is either use a slidey sheet, ask one of the nurses, they can provide you with one that you can place underneath your ankle, and you can bring your knee up and down, keeping your heel in contact. The reason that we say to use a slidey sheet is just so that you don't wear down your heel, we protect your skin. Or if you've got a dressing gown rope or even the TheraBand, you could wrap that around your foot and just use that to help the movement feel a bit easier. Okay, and again, you're looking at about 5 to 10 repetitions on each leg. So just switching the sides. And again, some days you might find that you can do one variation, some days it might feel a little bit more difficult. So just being aware and listening to your body and do what feels the best. Okay. The next movement we're going to be doing is we're going to get into a nice comfortable position. We're going to lower the head of the bed if you haven't been sort of in that position already. So nice flat bed if possible. If you find it too uncomfortable to be lying flat, you can keep a slight raise on the head of the bed. And you're going to be bending your knees up, feet are going to be flat onto the bed. And all you're going to be doing is imagine that you're almost tucking your tailbone under, or sort of almost like thrusting your hips forwards towards the ceiling. And if you're able to, with your arms next to you on the bed, you're going to try and lift your bottom up off the bed, squeezing your bottom muscles as you go. Now, as with all the movements, this isn't about speed, it's about nice and controlled. If you're unable to clear the bottom off the bed, don't worry. Just even that movement of imagining that you're thrusting your hip forwards, you're tucking your tailbone under, is good. So don't worry too much if you can't get the full clearance. But this is a really good movement to get into the habit of practicing, particularly if you're spending a long time in bed. It helps with cleaning if you're wearing pads. So it's a good movement to start practicing, of lifting that bottom up and nice and slow. Again, if you find that you're clearing it really easily, what you want to be doing to make it more challenging is, can you hold that position for a count of 5 and then nice and slowly back down. So that's to make it a little bit more challenging. Okay. Whilst we're in this position, we're going to do our second to last exercise for the lower limbs, which is something called the bent knee fallout. So again, feet are going to stay flat onto the bed. You're going to keep one leg still, and you're going to nice and control open your leg and bring it back to the middle. Now, what's really important for this movement is that you try and keep the leg that's not moving as still as possible. What you might find is that this leg starts to shake, but what we want to do is try and control that leg while we work this one here. So again, working towards 5 to 10 repetitions, super slow with the movements, avoiding rushing, because that's going to make this more challenging by going slow. Perfect. So I'm going to do a couple more on this side. If this is feeling too easy, what you can do is you can turn onto your side, and we can do something called a side clam. So feet and heels are staying together, and you're opening up the top leg and then nice and controlled back down. What you want to make sure is that your hips aren't rolling backwards. If you can place a hand on your hip as you open it, it's going to make it so much more challenging. So opening the gap between your knees. And the further progression of this would be to use the band, wrapping it around your knees, just to give a little bit of resistance. So that's quite a difficult variation, but if you're feeling like you're able to, you can use the band, and you should start to feel a bit of a burn in this muscle here, which is your glute muscles. Okay, so it's a really good exercise to do. And again, you just be repeating that the same on the opposite side. So that's the lower limb exercises. Now we're going to move on to some exercises for your upper limb. So again, getting in a nice, comfortable position. Ideally, just one pillow under your head, so you're not too far forwards or too far back. And we're just going to start with a bit of a warm up for your neck and your shoulders, because again, if you're spending long periods of time in bed, you might find that when you do then come to get out of bed, that your neck feels very stiff, or your neck muscles feel a little bit weak. The head is very heavy, so we need nice strong muscles to be supporting it. So the first one we're going to be doing, just as a bit of a warm up, is a chin tuck. So the idea with this is that you want to imagine that the whole of the back of your head is pushing into the bed, and you almost should be giving yourself a double chin and then sticking the head out forwards. Some people like to call this almost the chicken exercise. You're almost doing that forward movement and then pushing your head back. So you should almost feel like you're getting a double chin as then you stick your head forwards. Okay, just do a few of those. And then the next movement we're going to be doing is again just warming up for that neck, a bit of a little dynamic stretch as we bring the ear to the shoulder, back to the middle, and then ear to the opposite shoulder. So ear to the shoulder, back to the middle, ear to the opposite shoulder. And then just shrugging the shoulders up squeezing them down, shrugging the shoulders up and squeezing down. I know I'm turning my head slightly towards camera, but if you're able to, try and keep your head in that nice forward, sort of looking straight ahead position as you shrug your shoulders up and then squeeze them back down, shrug the shoulders up and squeeze them back down. Okay, now moving on to some exercises for your arms. The first one, similar to what we would do when we're in the chair, is a bicep curl. So palms are going to be facing up and you're going to bring your arms forwards to touch your shoulders and then nice and slowly back down. Now, if you're unable to reach your shoulder because of restrictions with your movement, or if you've got any cannulas in situ, then just go as far as comfortable with that movement. Again, if you want to make this a little bit more challenging, you could be holding water bottles, some light weights, or you could use the band. Now on the bed, there's a bit of a trick you can do. So you could put the side rail up, or if you've already got them up, and you could tie the band just nice and easily onto the bar so that you've got something to sort of ground the band. And then you can palm facing up, you can bend the band upwards, or bend your arm, sorry, upwards and then back down. Now to make this more challenging or more resistant, if you hold closer to where you've tied it, it's going to feel much tougher. If you want to make it less resistance, hold nearer to the end and it should feel easier. Okay, so that's for the bicep curls. The next movement we're going to do is a forward press. So again, in a nice comfortable position, don't worry about being laid flat or upright for any of these ones. Just get yourself into a position that feels comfortable for you. Palms are going to face in towards each other and you're going to be pushing the arms straight forwards, and then it's almost like you're squeezing your shoulder blades as you bring your arms back. So pushing your arm forwards, chest comes out, squeeze the shoulder blades. What you can do is you can use your pillow if you want a little bit of added weight for this, so pushing and coming back. Or again, using some light weights or bottles if you've got them in your hands. And again, you can also use the band. So if the band's still tied onto the bed, the idea that you're pushing forward, but your palm is facing towards the opposite hand. Okay, so again, you're going to be doing a few of those on each arm, working up to 5 to 10 repetitions as you go. Good. And then there's one final exercise for the upper limbs for the bed exercises, and that's an overhead press. So similar to what you were doing before, you're going to be almost reaching the arms up over towards your head. So as before we were going straight forwards, the final exercise you're going to be trying and lifting it more as if you're going up over your head. So again, just going as far as is comfortable with the movement, not pushing into any pain. And if you wanted to use the band, again, using that band to be lifting a little bit more, pushing over the head. Just do a few of those just to demonstrate. Nice and control with the movement. Remembering trying to go as slow as possible. Great, and there we go. That's the bed-based exercise programs. Well done, everyone.